Namaste, myself Dr. Poornima. Today I would like to tell you all about how safe menstrual cups are. So before talking anything else, I would just like to tell you all how the anatomy of our uterus will be. So this is the model of the uterus where you can see this is the main uterus and this is the cervix and this is the vagina. These are the ovaries on either side and this is the fallopian tube on either side. Okay. So basically what happens is we bleed, the uterine cavity will be full of endometrial thickness that is made up because of the collection of the menstrual blood will be on this part of the uterus. So what happens is at the end of 28th day or 30th day you start bleeding, that is the endometrium starts shedding. So that will come through your cervix and from the vagina it will be collected through your menstrual pads. So basically the concept of menstrual cups is, so just to tell you all, we all are aware of a tap and a bucket. So how better we can collect the water from the tap is through a bucket. So it will just spill otherwise. So what is the same technique is applied in menstrual cup. So this is called as menstrual cup, which is made up of highly bio acceptable material called as silicone, the one that we use in breast implants or any plastic surgery. The same material is used here. So it is super soft and very much moldable, and it will take up the position immediately once you release. Okay, so what happens is basically we are going to insert this in multiple techniques where we just fold it and insert it through the vagina and leave it. Because of the negative pressure created inside, automatically the cup will open. Once it opens, it starts collecting the menstrual bleeding that happens from your cervix or like from the uterus, that gets collected into the cup. So once the cup fills, you can just pinch it and take it out and spill it in the flush room and you can reinsert. Okay, this is how it is done. So now the problem is where the doubts of a layman comes. So the layman thinks that this cup is going to go into the uterus and cause them a harm. So there is nothing like that, because once you insert it, it is just going to stay within the cavity of vagina. So there is a vagina will be like this in 3D image. So where the your cup will be held in position like this. So it doesn't have any place other than vagina to go. So it will be stuck here only. It cannot migrate into the uterus because the uterine cavity cannot accommodate such big cup, and the opening of this uterus will be very small. Okay, apart from this, it cannot migrate into the abdomen because there is a clear-cut demarcation or the separate wall between the uterus and the remaining part of the abdomen. So it is very less likely or unlikely that it will migrate into any other places. So in simple ways, what I want to tell is it is very much safe to use this. Okay, and second doubt what I come across usually is, so will it cause infection? For infections to happen, you should have some erosions on the surface of the vagina, or you should have some rough surfaces on the margins of the cup. Okay, so both are not there here. So the margin of the cup is very soft. Even if you scratch onto your skin, it will not cause any erosions. So even if you insert it inside, it will not cause any damage to the vaginal wall. So there won't be any raw surface onto the vaginal wall, right? So the cup also is very safe and it will not cause any raw surface. When it doesn't have any raw surface and fresh bleed, so it will not cause any kind of infections. Okay, and the third thing what I come across is it will get stuck inside. No, it won't. Once the cup fills, you will have a sensation of fullness. So where even you might feel the air bubble passing through, because we have small holes here, so through which the blood starts leaking or the air bubble starts passing. So that's one feel that you will realize, and immediately you can go to washroom and empty it. I hope I have clarified all your doubts. If any other doubts are there, I would like to highlight them in my next video. Thank you.